In this module, I am going to discuss about the common childhood infections. I'll be discussing about the conditions which are associated with fever and rash, that is, exanthematous fevers in children. It's always a common clinical scenario based question which comes in your exam. They give the history of a child suffering from fever with rash. They tell you about the characteristic of rash and then they ask you about the diagnosis. Before I start discussing the individual conditions, I'm going to tell you an easy way to remember about how to diagnose a condition based on the day of appearance of rash. That is, on which day of fever rash appears will give you clue to the underlying condition. Okay? This can be remembered with a mnemonic called very sick persons must take rest. Here, the first alphabet in every word signifies a disease. For example, V in very stands for varicella. S stands for scarlet fever. P stands for pox. We have already seen varicella, which is chicken pox. So here it is smallpox. Then must, M for measles. Then take rest, T and R. That is T for typhus and R for rickettsia associated typhus. And what is the name of the typhus? It is epidemic typhus. Okay. Now imagine like this. In varicella, on the first day of fever, rash appears. Scarlet fever, second day of fever, the rash appears. Smallpox, on third day, the rash appears. Measles, on fourth day of fever, rash appears. In epidemic typhus, on the fifth day of fever, the rash appears. So this is a general rule or an easy way to remember. Depending on which day of fever the rash appears, you can tell the diagnosis. Now I am going to explain each of these conditions in detail and some other conditions also where you have fever with rash. I will not be discussing about smallpox because it has already been eradicated. So we will concentrate on the other diseases. Starting off with varicella. We all know that varicella is caused by a virus. It is a herpes zoster virus, HZV, which is herpes zoster virus, which is a double-stranded DNA virus. Okay, this is the causative agent for varicella or chickenpox. The other characteristic features which you should know is about incubation period. It is usually a range of 10 to 21 days. So around 2 to 3 weeks is the incubation period. The next thing to be known is the infectivity period. Infectivity period refers to the time at which it is transmissible from one person to another person. What is that? It is 24 to 48 hours before the onset of rash till all the lesions have crusted, or in simple terms, till all the lesions have dried off. Okay, right. So that is the infectivity period. And please remember, chickenpox is one of the highly contagious diseases, and in the household contacts, what is the secondary attack rate? It is high as 80%. So that is why it is always an important cause of easily transmissible disease, especially for the household contacts. What are the characteristic features of chickenpox? One, of course, is the fever. Okay. Initially, the patient will have fever. On the first day of fever itself, the patient will start having the rash. Now, this rash initially is a macular rash, then becomes papular, and very quickly it turns into a vesicular type of rash. And this vesicle will be filled with a clear fluid. Okay. I have told you the 3 forms of rash, but if they ask you what is the characteristic nature of the rash in chickenpox, you have to answer as vesicular rash only. Okay, right. And this rash is intensely pruritic. Okay, lot of itching would be present, and usually it starts in the trunk region. It starts in the trunk, then it spreads to the other parts of the body like the limbs. This pattern of progression of rash is called as centripetal rash. Okay, right. And this rash will last for around 3 to 5 days. And then it goes away, but while it is going away, it will leave behind a pigmentation. Leaves behind pigmentation. Which is brown in color. That is a typical nature of rash progression in a patient with chickenpox. In this particular picture, you can see the characteristic rash which is noted in varicella or the chickenpox. You can see that not all the vesicles or the rash is of same size. You see some are big and some are small in size. Why so? Because even though I said rash starts on first day, it will also appear on the second day, it will also appear on the third day and so on. So what happens? On third day, the rash which has appeared on the first day will appear bigger in size. The one which has appeared on third day will appear smaller in size. So if you look at the child, you will see that there will be different size of the rash which is called as a pleomorphic rash. We can also remember that there are different stages in evolution of rash at a given point of time. This is what I mean by pleomorphic rash. Different shapes will be present in a affected child. Okay. Now a closer look at the rash. Can you notice that it's a clear fluid-filled vesicle, and surrounding that vesicle you see the redness. Okay, so it's a clear fluid-filled vesicle surrounded by erythema or redness. This is what we call it as dewdrop in a rose petal appearance. So this is a classical description of rash in case of varicella or chickenpox. What are the complications a patient with chickenpox can develop? The usual complication is infection of the rash. Okay, sometimes the vesicles will rupture and it can become secondarily infected. So it is a secondary bacterial infection which is the most common complication in chickenpox. And the usual bacteria which are implicated are the common ones, namely Staphylococcus aureus and Streptococci pyogenes. These are the usual organisms which can cause secondary bacterial infections in varicella. Next, it can also be associated with neurological complications like meningoencephalitis, or it can also cause cerebellar ataxia. This association of varicella with cerebellar ataxia has been asked in one of the previously asked MCQ questions. Okay, the third complication which can develop is Reye syndrome. It is a very dangerous complication. So that is why while treating children with varicella, you avoid aspirin because aspirin has got an association with Reye syndrome. So remember, avoid aspirin to decrease the risk of Reye syndrome. These are the complications one can expect in varicella, even though the complication rate by itself is usually very, very less and the child usually recovers without any problem. Okay, how do you make a diagnosis? Please remember that chickenpox is purely a clinical diagnosis. Okay, if at all you have an atypical case where you are in doubt whether it's a chickenpox or not, then you can go for scraping of the lesion and you can do Zank smear examination. Okay, that is the diagnostic investigation. Another diagnostic modality possible is demonstration of antibodies against the varicella zoster, that is demonstration of anti-IgM type of antibodies against varicella zoster. These are the usual investigation which can be done in a child with chickenpox, but please remember diagnosis is always clinical. Regarding the treatment, please remember that these children require usually symptomatic treatment. For example, antipyretics like paracetamol for control of fever. That is all that is required. I've already mentioned that you will avoid aspirin because of the fear of, yes, Reye syndrome. Next thing, you will also avoid ibuprofen in these children because of the risk of necrotizing fasciitis. Okay, so that is why these two antipyretic agents are completely avoided in a child with varicella. You can also give acyclovir, which is the antiviral medication of choice while treating chickenpox. It is usually given in the dose of 20 milligram per kilogram per dose every 6th hourly. That means 4 times a day you have to administer this. And it is very, very clear that if you want to have beneficial effects from acyclovir treatment, it has to be started within a maximum of 48 hours. After 48 hours, there is no much benefit of acyclovir. As I was telling before that varicella has got a very high secondary attack rate of 80%. Or it's a highly transmissible disease. So that is why all children with chickenpox should not attend the school until new lesions appear and all the existing lesions have become dried or crusted. This is what we call it as period of isolation in varicella. This is also a commonly asked exam question. Is there any way by which we can prevent varicella? Yes, there is a varicella vaccine. And we all know that the vaccine strain is a OKA strain, which is a live attenuated vaccine. Please remember that it is not a vaccine under our national immunization schedule. However, Indian Academy of Pediatrics very clearly mentions that whenever it is afforded, the child should always get the vaccine. This vaccine is usually given as a subcutaneous injection. The dose is 0.5 ml given subcutaneously. And what is the schedule? It is given as 2 doses. The first dose is given at 15 to 18 months of age. And the second dose is given at 4 to 6 years of age. This is the schedule of chickenpox vaccine or the varicella vaccine. For post-exposure prophylaxis, you can also advise varicella zoster immunoglobulin for post-exposure prophylaxis. But it is not recommended for every post-exposure prophylaxis. Only certain group of persons are at risk and for them only we give post-exposure prophylaxis. This includes pregnant women, because they can transmit the virus to the fetus in utero itself. Next is a newborn whose mother developed chickenpox within 5 days before to 2 days after delivery. This baby is also at high risk of getting the infection from the mother. So this baby has to be given varicella zoster immunoglobulin. And third group of persons is immunocompromised patients. They also require varicella zoster immunoglobulin. So that is all about varicella or the chickenpox. We now move on to the second infectious disease, that is scarlet fever. Okay, as I have already said, this is also a condition characterized by fever with rash. When does the rash develop? Don't forget, sick is the second word. So on second day of fever only, there is rash in case of scarlet fever. Okay, let us discuss it in a detailed way. Okay, what is the etiology? It is due to streptococci, which is group A beta hemolytic streptococci. The common age group affected is the school-going children. So usually in the age of 5 to 15 years only, this infection is common. The characteristic features include, of course, fever. Along with the fever, on the second day, they develop the characteristic rash. Okay, and how does the rash appear in case of scarlet fever? Let's have a look at this picture. In this picture, you can notice the rash seen in case of scarlet fever. Okay, it starts from the face. It is a fine maculopapular rash. Okay, and then it spreads to the trunks. Okay, please remember that this rash never involves the palms and the soles. That's an important diagnostic clue. The next point to be noted here is this rash makes the skin appear to be rough, or it gives a rough feeling to the skin. That is why this description of rash in scarlet fever is also called as sandpaper rash. Another important finding related to this rash is you can see that in this picture of elbow region, you can see that the rash is unusually concentrated as a line in this area of elbow. Okay, so it is nothing but accentuation of rash in the skin creases like the elbow crease. Sometimes it can be noted in the axillary fold also. So it is nothing but accumulation or accentuation of rash at the skin creases, which is what is called as a Pastias line. That is also another characteristic feature of rash associated with scarlet fever. In addition to fever and rash, the other findings include sore throat. And because it's a bacterial infection, you will have pus pointing present. Okay, that's a very characteristic feature because in viral sore throat, you don't have presence of pus in the throat, but here definitely pus would be present. And you will also have associated tender lymphadenopathy, tender cervical lymphadenopathy. Usually, the anterior group of cervical lymph nodes are affected. Okay, and one more important point is if you look at the mouth region, you will see a very, very reddish tongue called as the strawberry tongue. Strawberry tongue is due to intense inflammation causing redness. Along with that, there is also hypertrophy papillae, hypertrophy of the papillae, which will also contribute to the strawberry tongue appearance in scarlet fever. These are the classical clinical features of scarlet fever that one should know about. Now, talking about the management of scarlet fever, the usual investigation which we can do is culture with the help of throat swab. So, throat swab culture. Is the investigation of choice. Please remember that there are rapid antigen testing also available. However, they are not the investigation of choice. Best investigation is always culture with the help of throat swab. And what is the treatment of choice? It is the penicillin. Usually penicillin G is used for the treatment for a period of 10 days. That is the investigation of choice in case of scarlet fever. You should also know about what are the complications which can occur in case of scarlet fever. Remember, it's a group A beta hemolytic streptococcal infection. So post-streptococcal complications can occur here. What are the complications I'm talking about? Yes, one is acute rheumatic fever. The other one is PSGN, which is post-streptococcal glomerulonephritis. Third, it can cause PSRA. What is that? Post-streptococcal reactive arthritis can also be present. All these are possible complications of a streptococcal scarlet fever. Next is another important infectious disease called as measles. What is the etiology of this? It is again a viral infection which is caused by a single-stranded RNA virus belonging to the family of Paramyxoviridae. Talking about the other basic features, the incubation period of this is 8 to 12 days. Okay, and remember, this is also a highly contagious disease. Usually it spreads by the infected droplet route from the secretions in the mouth or in the throat. Okay, and this also has got a very high secondary attack rate of more than 90%. Remember, for varicella, I told you it is 80%, but here it is more than 90%. So it is a highly contagious disease. Okay, and what is the infectivity period? It is 4 days before the appearance of rash till 5 days after the appearance of rash. This is the infectivity period. So during this time, the child is highly contagious and can spread the disease to others. What are the characteristic features of measles? It has got a typical sequence of event which has been asked frequently in the exam that you should know it very, very thoroughly. Okay. Initially, between the day 1 to 3, child will have fever and prodromal features. This prodromal features can be remembered with 3 C's. What are they? Cough, coryza, and conjunctivitis. These are the 3 C's seen in the prodromal phase of measles. And in this prodromal phase itself, between day 2 to day 3, you can see a typical finding called as the Koplik spots. What are these Koplik spots? You can see in this picture, there are some white colored spots surrounded by red color. These are the typical Koplik spots. Okay, this white color is called as the rice grain appearance. And this rice grain spots or the appearance is surrounded by redness or erythema. This is the typical description of Koplik spot, and Koplik spots are considered as pathognomic of measles. And what is the usual location of Koplik spots, which you can see in the picture itself? It is in the buccal mucosa. The classical description is it is opposite to second lower molar. This is the classical description of Koplik spots. Koplik spots can also be seen in the tongue as well as in the lips. Okay, so this has been asked as image-based questions also in your exam, so you should definitely make a note of it. So, moving on with the other findings in measles. On day 4 is the rash which is appearing. I've already said in the mnemonic, very sick persons must take double tablets. Here, must is starting with M, which stands for measles, and that is the 4th word. So on 4th day of fever only, rash appears. Okay, so day 4, rash appears. What is a typical rash which appears in measles? It is like this. It's a maculopapular rash which starts from the face, typically behind the ears it starts, and then it spreads down to the trunk and to the extremities. And please remember, the usual duration of rash is for 4 days. And after 4 days, it will disappear. But at the time it disappears, it leaves behind a pigmentation which is brownish pigmentation or a hyperpigmentation. This is a classical description of rash associated with measles, a very commonly asked question again. Okay, right. So on day 4, rash appears, and this rash will be there for next 4 days. Okay, so if there is a question on what day of illness the rash disappears, it is day 4 and next 4 days. So on day 8, the rash will disappear. This is the typical sequence of event which occur in measles. Okay, some of these children, after the course of illness is over, they develop complications. The complications can be divided into acute complications and chronic complication. The most common overall acute complication is otitis media. However, if the question is slightly modified, which is the most severe acute complication, then it is bronchopneumonia. This bronchopneumonia associated with measles can be due to 2 reasons. One, it is directly associated with the virus itself, or the etiological agent in pneumonia is virus itself. We call it as the giant cell pneumonia, or also called as a HECT pneumonia. It is direct virus involvement causing pneumonia. More commonly, it is secondary bacterial infection which is causing pneumonia. The usual organisms implicated in causing pneumonia in these children include Staphylococcus aureus and Streptococcus pneumoniae. Okay. These are the usual acute complications in measles. Now, if a question is asked about what is a chronic complication in measles, it is a very, very important condition called SSPE, which stands for subacute sclerosing panencephalitis. Okay, this condition usually occurs 7 to 13 years after the initial infection. That means the child would have got the measles, say like at 1 year of age or 2 year of age. Only by 9 years or 10 years of age, the child is going to develop this complication. So this is a chronic complication of measles. Okay, and this is a condition which is very, very severe condition. It is associated with decrease in the school performance, behavioral problems, as well as myoclonic seizures. This is an important question. What is the type of seizure you get in SSPE? It is myoclonic seizure. And these myoclonic seizures are very, very difficult to control seizures in these children. And most of these children, it ultimately results in death, or this condition is a fatal condition. What are the investigations which can help in diagnosing this condition? One, you can do the CSF testing to look for measles specific antibodies. That is IgG, measles specific antibodies. In the CSF you can do. This has been asked as an exam question before. Second thing, you can do the EEG, which will reveal periodic high voltage discharges on a slow background. And this is what is called as Rademacher complexes. Rademacher complexes. This Rademacher complex as a EEG finding is again a possible MCQ question in your exam, so you should make a note of it. Okay, as I said before, this is a very difficult to treat and often fatal condition. However, some symptomatic treatment can be possible and improvements in the child's symptoms is noted with some drugs. The commonly used drugs for this condition include isoprinosine along with interferon gamma. Interferon gamma. These are usually immunomodulatory agents which can help in decreasing the severity of symptoms in this patient, but please remember most of these children will ultimately succumb to the disease. Interferon gamma is usually given by intrathecal route. Okay, so these are the essential points which one should know about the most important chronic complication of measles, and that is SSPE. Remember, measles is a clinical diagnosis only and treatment is mostly supportive. You should give IV fluids if the child is not able to take orally, or if the child is able to take orally, lots of oral fluid along with antipyretics. That is all required in the supportive management. And an important role is there for a micronutrient. And what is that? It is vitamin A. It is said that when the children are recovering from measles, a single dose of vitamin A has to be given. The dose is decided by the age of the child. If the child is less than 1 year, you give 1 lakh international units. And if the child is more than 1 year of age, you give 2 lakhs international units. And what is the route of administration of vitamin A? It is always oral administration. What is the need for giving vitamin A to these children? It is supposed to decrease the morbidity as well as mortality associated with measles infection. Okay, that is the reason why we are giving vitamin A for these children at the time they recover from the disease. Can you prevent measles infection from occurring? It is very well possible because we have a vaccine which is given as MMR vaccine, which is mumps, measles, rubella vaccine, which is included in the national immunization schedule itself. So this is definitely a vaccine preventable disease. So those are all the important points which you should know regarding an important childhood infection of measles. Moving on to the next condition, which is exanthema subitum. Now this is a condition which has got some clinical importance because of the day at which rash appears in this condition. Remember, for measles I told you on 4th day of fever rash appears. Here also on 4th day of fever only rash appears. So this is a condition which can be sometimes be confused with measles. Alright, so I am going to tell you how to differentiate this condition from measles. But before that, let us start discussing some basic facts about exanthema subitum. Now there are other names of this exanthema subitum. It is also called as a 6th disease, or it is also called as roseola infantum. Roseola infantum. The common causative agent for this infection is human herpes virus 6. That is what I am writing as HHV6. Sometimes it is also associated with HHV7, that is human herpes virus 7, and rarely it can be associated with echovirus type 16. Okay, these are the usual etiology, but overall the most common etiology is always HHV6, and that is a commonly asked exam question. Okay, next you should know about the features. As I have already said, you will have fever. In the first 3 days, you will have a viral prodrome as well, which includes letharginess or tiredness along with cough and running nose. These are the usual viral prodromes which you can get here also. Now, on day 4, I told you rash is going to appear, which is almost similar to measles rash because this rash is also maculopapular. Now comes the important question to be answered. How will you differentiate this from measles rash? Please remember, this rash starts from the trunk region. Very important. If you can correlate with measles, I told in measles, the rash starts from the face, especially behind the ear. But here it starts from the trunk. That is a number one difference. The second difference is after the rash starts, the fever will decrease. Whereas in case of measles, what happens is the fever increases with the appearance of rash. Here, fever decreases at the time when the rash appears. That's a second very, very important difference. Third important point to be noted is when the rash disappears, there is no residual pigmentation. When you compare it with measles, in measles I told when the rash disappears, it leaves behind a brownish desquamation. Here, there is no desquamation or pigmentation once the rash is gone. So this is how you differentiate the rash associated with exanthema subitum from the rash associated with measles. Even though both are maculopapular rash, I have already told you the differences which one should always remember. Because if they want to put up a clinical scenario question, these are the points they are going to highlight and ask in the exam. This is a typical rash which you can see is again a maculopapular rash, but it starts from the trunk region. Okay. Now you can see that the child also appears to be relatively well at this time because, as I said, when the rash appears in this condition, the fever would have decreased, so the child would be more comfortable at the time of rash. In measles, the fever is actually increasing at the time of rash, so the child would appear more sick at the time of rash. That's also one more important distinguishing point between exanthema subitum and measles. Now, in addition to rash, there is also another finding called as Nagayama spots in case of exanthema subitum, which refers to ulcers at uvulopalato-glossal junction. This is the classical Nagayama spots which are also associated with exanthema subitum. Okay, so these are some of the important features regarding exanthema subitum that one should know of. This condition is usually treated symptomatically with antibiotics and fluid, and the outcome is excellent because it is usually not at all associated with any other complication. Okay, so those are the important points that one should remember about exanthema subitum. The next condition is rubella, which is caused by a single-stranded RNA virus belonging to the family of Togaviridae. Okay, and this condition has an incubation period of around 14 to 21 days. This condition is also transmitted as droplet spread from one person to another through the infected secretions from the mouth or the throat. And the usual infectivity period is 5 days before to 6 days after the onset of rash. Okay, this is the typical infectivity period for rubella. Now, this rubella was previously called as 3-day measles, or it was also called as German measles. The reason because the rash in rubella appears similar to that of the measles rash in the sense that it is maculopapular and starts from the face only, but the total duration of rash is only 3 days. That's why it's called as the 3-day measles. Now, in this particular condition, before the appearance of rash, some children may experience prodromal features. Like fever, cough, running nose, okay, just like any other viral illness. However, some of the children, they don't experience prodromal features also. So, prodromal features can either be present or absent in case of rubella. That is why Nelson textbook of pediatrics very clearly mentions that the first sign of rubella in most of the children is usually the rash. Okay. And what is the description of rash? Again, it looks just like a measles rash only. It is a maculopapular rash. Okay. same, starts from the face or behind the ears and then spreads to the trunk. However, the usual duration is only 3 days. As I have said before, that's why it's called 3-day measles. And once the rash disappears, there is no desquamation or there is no residual pigmentation. Always remember, when measles rash disappears, it will leave behind a desquamation or a pigmentation. Okay, here there is no residual pigmentation or desquamation. Other common features of rubella include Forshemer spots. These Forshemer spots appear at the time of rash only, but they are present inside. Where exactly? In the oropharynx. In the oropharynx, they appear as tiny rose lesions. That is a classical description of Forshemer spots in case of rubella. Another important feature is presence of lymphadenopathy. The common group of lymph nodes affected include suboccipital lymph node, posterior auricular lymph nodes or post-auricular lymph nodes, and third is anterior cervical lymph nodes. These are the usual group of lymph nodes affected in case of rubella. These are the classical clinical features which you encounter in rubella. Don't forget the word of 3-day measles. Rubella in general is a very good disease, usually not associated with complication. Very, very rarely only the children may develop complication. The usual complication, if at all develops, is a post-infectious thrombocytopenia, which usually occurs 2 weeks after the onset of rash. Usually it's a self-limited condition. The second complication is arthritis, which usually develops in adolescents or adults, not in young children. The third important complication is, if at all occurs, it's a life-threatening severe complication, and that goes by the name of progressive rubella panencephalitis, which is abbreviated as PRP. Progressive rubella panencephalitis. Okay, now this condition has got similar clinical features like that of SSP, and like SSP, this is also usually a fatal condition. Is rubella a preventable disease? Definitely it is a preventable disease because we have this MMR vaccine in our national immunization schedule and is given to all children. MMR is mumps, measles and rubella, where this infection will be covered. Okay, right. Now, another important use of the MMR vaccine is to prevent infection during the time of pregnancy. Okay, because if a pregnant lady gets rubella, okay, she can transmit it to her baby in utero itself, and that can predispose to congenital rubella syndrome. Congenital rubella syndrome and other intrauterine or torch infection has been covered separately in another module. So that is about the rubella infection in children. Moving on to the next condition, that is erythema infectiosum. This is again a viral disease which is caused by parvovirus B19. And this virus is a single-stranded DNA virus. This virus has a long incubation period, IP, which is around 4 to 28 days. So you can easily remember as 1 week to 1 month, like that you can easily remember. And this condition usually affects school-going children. Okay. Now talking about the features of erythema infectiosum, this condition will have fever with prodrome, same viral prodrome, for 1 to 2 days. And following that, you will have the typical rash occurring in erythema infectiosum. This is how the rash appears. The rash initially starts in the face, and you can see the intense redness in the cheeks. Okay, on both sides of the cheek, you can see the intense redness. This is what we call it as a slap cheek appearance. Okay. So the rash usually starts in the face and then spreads to the trunk. And as the rash spreads to different parts of the body, I'm talking about the trunk area, what happens is there is a central clearing in the rash. What is the meaning? The center part of the rash becomes white. This gives rise to a typical appearance called as lazy appearance or reticulated appearance. So don't forget the slap cheek appearance and the lazy or reticulated appearance, which is the characteristic of rash in erythema infectiosum. This picture describes the classical lazy or reticulated appearance. Can you notice very clearly here? The center of the rash is white in color and redness is noted in the periphery. This is the description which I was talking about as the reticulated pattern or the lazy pattern. This is the classical clinical feature of erythema infectiosum. Other associations of erythema infectiosum include arthralgia and arthropathy. This is usually encountered in older children or adolescents only, not in young children. The next important association is in children with chronic hemolytic anemia. For example, sickle cell anemia. It can predispose to transient aplastic crisis. And during this time of aplastic crisis, there would be decrease in all cell count or there would be pancytopenia. And if this condition occurs in pregnancy, it can be associated with a very dangerous complication called as hydrops fetalis. And because of this complication, it can be associated with intrauterine death or stillbirth. These are the other features of erythema infectiosum that one should be knowing about. Please remember, in children, it is generally a self-limited disease and symptomatic treatment is all that is required. The next condition is another fever-associated rash condition, and that is epidemic typhus. What is the causative agent for this condition? It's a rickettsia-associated infection. What is that exact name? It is Rickettsia prowazekii. How is this condition generally transmitted? It is by the feces of the infected body louse. So it's a louse-borne infection. That is an important point regarding transmission of epidemic typhus. Talking about the features of epidemic typhus, it is usually characterized by a triad of fever, rash, and headache. However, please remember, this triad is usually encountered only in 50% of patients and not all. And out of this triad, the most important feature is the rash, which will lead to the diagnosis. Okay? Can you recollect on what day of fever rash appears in epidemic typhus? Again, go back to the mnemonic I have told you. What is that? Very sick person must take rest. That take rest was the last part, which is for T for typhus and R for rickettsia. And when is it coming? As the fifth word it is coming. So on day 5 of fever, only the rash appears in case of epidemic typhus. And the characteristic nature of the rash is that it is a purpuric rash. And it involves the palms and the soles. This particular point is very, very important because most of the rash associated with infectious disease, they don't involve the palms and soles. So this involvement of palms and soles is considered as very characteristic. Have a pictorial memory of this picture which tells you the typical purpuric rash in a patient with epidemic typhus, and you can very clearly see that the palm is getting affected. These are the characteristic clinical features of epidemic typhus. Once you have diagnosed this condition, what is the drug of choice? It is always doxycycline. This is a repeatedly asked MCQ question as to what is the drug of choice in typhus. It is doxycycline. Remember, the treatment should be given for a minimum of 5 to 7 days and for at least 3 days after the patient becomes afebrile. This is required to prevent relapse. To prevent relapse of the infection in the same patient, we are giving like 3 days after he becomes afebrile. So that is about the treatment of epidemic typhus. The last infectious disease associated with fever and rash is hand, foot, mouth disease. As you can infer, the areas commonly affected are the hand, foot and mouth. That's why it is named accordingly. This is a common viral illness usually occurring in children less than the age of 5 years. And usually this condition occurs as outbreaks in preschools. That is, in kindergarten, it usually occurs as outbreaks. Okay. And what is a causative agent? As I've said already, it is a virus, and the common virus is Coxsackie A16 and enterovirus 71. Okay, these are the usual causative agents, and this infection is usually transmitted by direct contact or by usage of infected fomites. That is how it usually spreads. Usually it starts with a fever, and along with the fever, the child will have ulcers or blisters in the oral cavity, in the lips, tongue, buccal mucosa, and even in the skin surrounding the mouth also. That is where they have this ulcers or the blisters. Something like what you see in this picture. This picture depicts the classical blisters noted around the mouth in a child with hand-foot-mouth disease. Another important feature is what you see in the hands and feet. This picture depicts the soles. It can also be seen in the palms also as papulovesicular lesions. So as you can see, the palms, soles and the mouth area is affected. That's why it gets the name as hand-foot-mouth disease. This disease is usually an uncomplicated disease, does not cause much problems to the child, and the lesions, they resolve over 4 to 5 days. Symptomatic treatment is all that is required, and the only point to be noted is because the infected children can transmit to healthy children, you need to keep them in home until all the lesions have resolved. Okay, so it is very important that you isolate the affected children at home till all the lesions have settled. That is about hand-foot-mouth disease, and with that we complete the common childhood infections characterized by fever and rash. Please don't forget the important mnemonic which helps you in remembering the disease according to the day at which the fever appears. What it is very sick person must take rest. V for varicella, S for scarlet fever, P for pox, which is smallpox, and M for measles, and last one is T for epidemic typhus. That completes the discussion of this particular module.